So I want you to think about the shock absorbers on your car for a second.
Okay.
Every single time you drive down the street, they are just taking an absolute beating.
Right.
They hit the speed bumps, they absorb the potholes, they handle all that uneven pavement, and they do it all so that you, sitting in the driver's seat, just feel a perfectly smooth ride.
Yeah, you don't even notice them.
Exactly. We never, ever notice them right up until the exact moment they completely break.
And then the whole car starts violently rattling.
Right. The whole car starts rattling. And in the ecosystem of a K-12 school building, the principal is that shock absorber.
Oh, that's a really good way to put it.
Yeah. And so today on the deep dive, we are looking at this really invisible, honestly crushing weight of burnout on school administrators. And we're going to explore how a comprehensive mental health support system operating right here in Georgia, it's called MentalSpace School, how they are trying to fix that entire ecosystem by starting with the people at the very top.
It really is a quiet crisis.
Yeah.
And it's entirely baked into the architecture of educational leadership.
Yeah.
Because we are talking about an immense top-down pressure cooker. I mean, the focus is almost always on the students or the teachers, as it naturally would be, right?
Of course.
But the reality for principals and assistant principals, too, is that they are sitting in their offices long after the final bell has rung, basically absorbing everyone else's panic while trying to hold the foundation together.
Well, and the daily reality they navigate, it's just grueling.
Right.
Like, just looking at the source materials and running through a standard Tuesday for a principal.
Yeah.
It is exhausting just to conceptualize.
It really is.
You might have to absorb a bus incident before 8 a.m.
And a bus incident isn't just, a fender bender.
No, not at all. It means managing the logistics of rerouting kids, calming down terrified elementary students,
Right, yeah.
coordinating with district transportation, and then fielding panicked phone calls from like 30 different parents.
All at the same time.
All at the same time. And all while standing on the sidewalk, just, smiling to make sure the rest of the school day starts normally for everybody else.
Yeah, you have to project that total calm.
Right. And then you walk inside and you have to deal with, say, a crying first-year teacher who is completely overwhelmed by a behavioral issue in their classroom.
Which happens a lot.
A lot.
Yeah.
Followed by a highly combative phone call with a family over a disciplinary measure. And sitting on your desk the entire time is a district deadline for state compliance.
Just looming over you.
Just looming.
Yeah.
And the kicker is that the unwritten rule of the job requires you to do all of that without letting a single crack show in your demeanor.
Maintaining that stoic face is, it's the ultimate expectation. You are the pillar of that micro-community.
Yeah.
You cannot show panic when the bus is delayed, and you cannot break down when a new teacher is having an emotional crisis in your doorway.
Because if you panic, they panic.
Exactly. The principal's job, on a psychological level, is to perfectly regulate their own emotions so they can co-regulate everyone else's. Wow.
Yeah.
And because the school day is entirely consumed by putting out those localized fires, the actual administrative work, the long-term planning, the budget analysis, the paperwork, it all gets pushed to what is often called the quiet hour.
And that concept of the quiet hour, it's so bleak when you really think about it.
It is.
Because the only time they can actually do their job is when the building is entirely empty of the people they're actually there to serve.
Right.
It creates this paradox where the job itself literally prevents them from doing the job until everyone leaves.
What's fascinating here is how this environment fundamentally redefines what burnout actually looks like at the leadership level.
How so?
Well, we have this this pop culture image of burnout as something highly dramatic.
Like someone throwing their hands up in the middle of a meeting.
Yes, or clearing their desk into a cardboard box and just walking out the door in a blaze of glory.
Right, like Jerry Maguire or something.
Exactly. But at the administrative level, it is an insidious, slow-moving erosion.
It doesn't look like a breakdown. Based on what we're reading here, it looks like decisions simply taking longer than they used to.
Yeah.
Just because the cognitive load is so heavy.
Yes.
Or it manifests as feeling uncharacteristically short or irritable with the colleagues you actually like and respect.
Which then creates guilt.
Right. More stress. It's losing sight of the why, the reason you got into education in the first place, and replacing it with this pure survival mentality.
Just getting through the day.
Just getting to Friday. And then the one that hits the hardest, I think, is sleeping without ever really resting.
Oh, that's a big one.
You go to bed, but there is just that low-level hum of anxiety about the next day that never actually turns off.
And then you find yourself secretly counting the years you have left until you can safely access your retirement pension.
Yeah?
That private internal countdown, asking yourself, how many more years do I have in me? That is the hallmark of profound emotional exhaustion. Because you are the person everyone in that building leans on, but the structural failure of the system is that you are not supposed to carry it all alone. We have designed a paradigm where the leader is entirely structurally isolated.
But why is that isolation treated as an unspoken rule? I mean, we hear about teacher burnout constantly.
We do.
It's in the news. There are endless think pieces about it. It's a recognized, validated crisis. But the administrator's burnout, it just seems to be accepted as the cost of doing business. Why is the principal expected to suffer in total silence?
Because at the top of the pyramid, there is a cultural demand for invulnerability.
Invulnerability.
Right. Think about it. Teachers have a built-in peer group within the building.
Yeah, they have the teacher's lounge.
They have the lounge, they have unions, they have grade-level teams to vent to. They are a collective.
Right.
A principal is singularly alone in their role. If a principal admits they are drowning or overwhelmed, the immediate fear is that it signals instability to the teaching staff, the district superintendent, and the parents.
So they just bottle it up.
They internalize it. They become the ultimate container for everyone else's anxiety, but the system provides no container for theirs.
Okay, let's unpack this, because this specific isolated pressure is exactly where MentalSpace School steps in.
Yes.
Because an administrator's stress is so highly specialized, a generic corporate wellness program is just utterly useless.
Completely.
Like a yoga voucher or a meditation app or even an 800 number for a telehealth therapist. That is not going to fix the reality of navigating an angry parent and a state education mandate before 9 a.m.
Generic wellness initiatives fundamentally misunderstand the assignment here. MentalSpace School built their staff wellness program to expressly include administrators.
Custom built for them.
Custom built for the incredibly specific reality of running a school.
It's almost like, going to a generic therapist as a principal is like having to explain the rules of baseball before you can even complain about a bad call.
That is a perfect analogy.
Right. If you decide to go to an out-of-network therapist and sit on their couch to vent about your day, you have to spend half the session explaining the bureaucracy.
And you don't have time for that.
You don't.
Yeah.
You have to explain state testing rubrics and district politics and funding structures.
It's exhausting just to explain it.
Yeah. But MentalSpace specifically provides therapists who actually understand school life. So you aren't going to spend your first session explaining what a Title I audit is.
And the time to value metric in therapy is critical here.
What do you mean by time to value?
Well, for those outside of the education sector, a Title I audit is a massive, high-stakes federal compliance check.
Okay.
Title I provides federal funding to schools with high numbers of children from low-income families.
Got it.
To keep that money that pays for reading interventionists, counselors, essential resources, the principal has to prove that every single dollar is being spent compliantly.
Oh, wow. So they're tracking every dime.
Every single dime. It requires mountains of paperwork and carries the constant threat of losing vital school funding.
That's terrifying.
It is. So if you only have that one quiet hour at the end of the day, you do not have 4 weeks to build a baseline understanding of federal education funding with a new therapist.
Right. You just need to get right to the point.
Exactly. You need to sit down and say, the district is breathing down my neck about a Title I audit.
And have the therapist instantly understand the gravity of that.
Instantly understand the stakes and the specific type of panic that entails.
And the logistics actually match the reality of a principal schedule, too. MentalSpace offers same-day teletherapy and evening appointments.
Which is so necessary.
Because you cannot exactly step out of the building for a 2 p.m. therapy session when you are in the middle of breaking up a fight in the cafeteria or running a fire drill.
Right. It removes the logistical friction entirely, but the logistics are secondary to the psychological safety they build into the model.
The confidentiality piece.
Yes. The entire system is totally confidential, IPA compliant, and intentionally designed so that the district does not see who books an appointment.
Okay, here is where it gets really interesting. Because that specific detail, the district being blind to it, is massive.
It is the only way the system functions.
Really?
Yeah, going back to that fear of appearing vulnerable, an administrator will never, under any circumstances, utilize a mental health service if they suspect the district superintendent is going to get a utilization report with their name on it.
Oh, of course, because then it looks like they can't handle the job.
Precisely. By completely severing that reporting line, MentalSpace creates a true safe harbor.
It allows leadership to seek help without risking their professional standing.
Or projecting weakness to their superiors.
Okay, but a well-rested, perfectly regulated principal is still going to break if the school around them is on fire.
Fair point.
Right. Fixing the leader is a fantastic start, but their stress is ultimately driven by the building's overall ecosystem and the state mandates raining down on them. How does treating the principal scale to the 1,000 kids running around the building?
Well, the stack wellness component is just one piece of a much larger K-12 student support framework.
Oh, okay.
Yeah, MentalSpace isn't functioning as a standard employee assistance program. They are providing an ecosystem-wide intervention.
Meaning what, exactly?
They deploy dedicated therapist teams per school.
Per school.
Per school. These teams handle crisis intervention, suicide and violence prevention, and comprehensive family counseling.
Which brings a massive compliance aspect into the picture.
Huge.
They guarantee FERPA and HIPAA compliance for all of this, which is obviously crucial when you are dealing with student medical and educational records.
Right.
But they also highlight compliance support for HB 268, pointing to a deadline of July 2026.
If we connect this to the bigger picture, the context of that date is vital for understanding the current pressure in these schools.
Because today is August 19, 2026.
Exactly. We are right in the immediate aftermath of that deadline.
The ink is barely dry.
Right. Schools across Georgia are currently operating in the high-stakes reality of a post-HB 268 world.
What does that actually mean for the principal?
State mandates like this typically require strict, documented protocols for student mental health, safety interventions, and threat assessments.
Okay.
It means the principal is now legally on the hook for preventing and tracking crises.
Oh, legally.
Yes. If a step is missed, it isn't just a bad performance review. It is a legal liability.
Wow.
The pressure cooker is at maximum capacity as this new school year begins. So when we talk about a principal absorbing a district deadline, we are talking about this exact moment in time, scrambling to ensure the building is compliant with new state laws.
Wait, I have to push back on the logistics of pulling this off.
Okay, go for it.
Because offering everything from acute crisis intervention to ongoing family counseling for an entire student body, that sounds like a massive undertaking.
It is.
If I am an already burned out principal who is terrified of an HB 268 compliance audit, introducing a giant new mental health vendor into my building sounds like it can easily become just another administrative nightmare.
I can see why you'd think that.
Right. How does this not just add a massive new pile of oversight to the principal's desk?
The operational mechanics are the differentiator here. MentalSpace embeds a dedicated self-managing team into the school's ecosystem.
Self-managing.
Yes. They are not just handing the principal a list of 1-800 numbers or telehealth links to pass out to students in crisis.
Which is what usually happens.
Right. The objective here is to completely offload the mental health triage from the administration.
Oh, I see.
When a student is having a psychiatric crisis or a family requires deep counseling to handle a trauma at home, the principal and the teachers are no longer forced to act as makeshift social workers.
They can just hand it over.
Exactly. They have a dedicated, compliant, in-house team to hand that situation off to.
So they're essentially outsourcing the heavy emotional lifting to licensed professionals.
Yes.
Freeing up the principal to actually go back to being an educational leader rather than a crisis negotiator.
That's the goal.
But a massive school-wide mental health apparatus with dedicated therapy teams, that sounds incredibly expensive.
It does.
Like prohibitively expensive for a public school budget. How are students and families actually accessing this without hitting a massive financial wall?
Accessibility is clearly the primary focus of their model, because an ecosystem approach only works if everyone in the ecosystem can use it.
Right.
So they have actively engineered the financial barrier out of the equation.
How?
Well, for Medicaid patients, the cost is $0.
$0.
Zero.
For a Title I in school where a huge percentage of the student body might be on Medicaid, that is a complete game changer.
It really is. And for families not on Medicaid, they accept a massive, comprehensive roster of commercial insurances.
FICO.
They work with BCBS, Cigna, Aetna, UHC, Humana, Peach State, CareSource, and AmeriGroup.
Oh, wow. So pretty much everyone.
Exactly. By blanketing the insurance landscape, they ensure that the vast majority of the student body can actually utilize the therapy without creating a sudden financial crisis at home.
And looking at the materials, the workforce providing these services is made up of licensed, diverse therapists who are culturally competent,
Yes.
which makes total sense. You need the therapist to actually reflect and understand the nuances of the community they're embedded in.
For the exact same reason the principal needs a therapist who understands what a Title I audit is.
Right, exactly. Everyone needs to feel seen and understood by the person treating them, otherwise the trust never forms.
It is about aggressively removing every possible point of friction between the person in pain and the person who could help them.
Make it as easy as possible.
Exactly. And they make the contact vectors incredibly straightforward for anyone trying to initiate that help.
Like, where do they go?
Whether it's through mentalspaceschool.com or directly via email at mentalspaceschool@chichitherapy.com.
So what does this all mean for the school on a practical level? Because let's look at the hard outcomes of this systemic approach, because this is where the rubber really meets the road.
Right, the data.
MentalSpace shows an 89% improved attendance rate.
89%.
Yeah, and a 92% reduction in anxiety,
That's massive.
and an 85% family satisfaction rate.
Wow.
And I really want to focus on that 89% improved attendance figure and connect it right back to the principle we were talking about at the beginning.
Oh, yeah, the attendance ties directly to them.
Better attendance obviously means kids are in the classroom learning, right?
Yeah.
But from the principal's desk, school funding is tied directly to average daily attendance.
It's all about the numbers.
If kids aren't there, the school literally loses money. Poor attendance also means endless, grueling truancy meetings with parents and the district.
Which takes up more time.
Right. An 89% improvement gives the principal hours of their week back.
Just reclaims that time.
Yeah. And that 85% family satisfaction, that translates directly to significantly fewer of those combative, hard family calls that the principal was having to absorb at the end of the day.
You have identified the exact systemic feedback loop this program creates.
Because it's all connected.
It is. By providing robust clinical support directly to the students, by effectively reducing their anxiety by 92%, the program inherently reduces the daily, localized crises that the administrators have to absorb.
Fires get put out before they start.
Exactly. When the students are emotionally regulated, when the families feel heard and supported by professionals, the temperature of the entire building drops dramatically.
Yeah.
The principal is no longer hitting a massive pothole every 10 feet.
They're completely smoothing out the road.
It is a dual approach to the ecosystem. You give the principal a private, highly confidential lifeline to deal with their own accumulated burnout.
Right.
And simultaneously, you systematically lower the overall stress level of the building they were trying to manage. You are repairing the shock absorber while simultaneously repaving the road it drives on.
That's brilliant. So to summarize the core takeaway from our deep dive today, MentalSpace School really recognizes that building a truly healthy K-12 environment in Georgia, it requires way more than just checking legislative boxes for student support.
Much more.
It requires acknowledging the very real human toll on the leadership. It means not just supporting the kids, but offering highly specialized, totally confidential lifelines to the adults who are holding the entire building together.
Right.
They're essentially telling administrators, you make sure everyone in this building had someone to lean on today. Take 5 minutes and do it for yourself.
Which is so powerful.
It is. And you can see the framework for yourself by visiting mentalspaceschool.com.
You know, if you look at the broader implications of what this model is trying to achieve, it raises an important question that extends far beyond just this one program.
Oh, really? What's that?
Well, if initiatives like this successfully normalize principals and teachers seeking therapy, especially with that ironclad guarantee that the district is entirely blind to it,
Right, taking away the stigma.
right, how might that alter the very nature of school leadership?
Right.
Because for generations, education leaders have been forced to act as unfeeling shock absorbers, silently taking the hits until they quietly burn out and retire early. But if we actually change the system, could emotional vulnerability and healthy enforced boundaries become the new professional standard for running a school?
That would be a completely different world.
Imagine a future where a principal saying, "I need a minute to process this," isn't viewed as a liability or a weakness, but as the gold standard of effective, sustainable leadership.
Wow.
It makes you wonder how much healthier our entire education system could be if the people running it were finally allowed to be human.